So the book I'm reading, The Heart Healers by James S. Forrester, who's a medical doctor. I'm currently reading the chapter, The Pain of the Pioneer. So the last chapter I was talking about, there were two cardiologists, and they were sort of fighting for the mantle of father of cardiology. And so what they were doing, because before it was sort of not allowed to touch the heart if there would be any wounds or any problems with it. You would sort of let the person die, like let them bleed out eventually. And so the problem last time was mitral stenosis. And so mitral stenosis is when the valves of the mitral valve don't open up enough. And if they don't open up enough, not enough blood gets through, there's just a lot of swelling behind like any vein or artery that's behind the mitral valve. And eventually that where the blood is, it'll slowly expand until it can't take anymore. And then essentially it'll burst, and where the mitral valve is, it's very close to the left atrium. I'll kind of show you to give you an idea. So this is the left atrium. And so since it's really close to the left atrium, where the left atrium was before is the lungs. So thus, blood will burst, and essentially the person will drown in their own blood. So not very not really the nicest thing you want to imagine. But eventually, after killing 4 patients, Dr. Bailey, he eventually he thought of trying to put his finger in between the mitral valve, kind of to maybe open up the valve. And so for this last patient, he opened it up a little bit, because before, whenever he would try to put his finger through it, he would sort of rip out the valve. And so for the last person, he would open it up just for the valve to open up so you can put a scalpel in between. And since 2 leaflets of the valve were kind of sticking together, which was the problem, he kind of cut it open so then the valve would open up more. And so this patient actually lived. And while he was doing this, he was getting a lot of criticism because he was told that he was Butcher Bailey because he killed 4 people before doing this. And although that seems like a lot, Dr. Harkin, the man who was like trying to go against him, who actually succeeded the same way about 5 days later, he killed 6 patients. So in total, there were 10 patients killed before the first successful mitral valve surgery. So, and then later they start saying that mitral valve stenosis would slowly fade away, and then bigger problems such as coronary artery disease, or CAD, would be known. And the author also says to himself that something like mitral stenosis is not very common for him to see. He only sees it in immigrants that come to America who come from just underdeveloped countries. So, so then Harkin and Bailey's, the way that they were trying to push to solve this problem was the first 2 signposts that emerged from cardiac surgery just after World War II. Because after a war, surgeons were able to try new things that weren't really allowed before. And if they were to be done successfully after the war, they would sort of deny what the elders said before, that do no harm first, and eventually they would do no harm and still cure a person who would eventually die out. And something as small as like the hole in the heart was something that you weren't allowed to touch back then, like I said at the beginning of the video. And so after figuring out mitral stenosis, they sort of turned their sights to a more important valve, the aortic valve, which is in between the aorta and the left ventricle. And so the aorta is extremely important. The aortic valve is extremely important because after the aorta, it goes to the rest of the body. So if all the blood is not very important, if it's not treated correctly, then the rest of the body won't get enough blood as it needs. So just to kind of tell you, stenosis is when the valve is sort of too closed and not enough blood is passing through it. So he tries doing aortic stenosis again, and because he got depressed last time, in the beginning, after the sixth person, he was so depressed. He just, as soon as he came home, he just went up to his bed and just slept, and he wasn't encouraged until one of his fellow cardiologists said, "It's a shame that you've killed these 6 people, but it'd be a waste if you just do nothing about it, and you might as well keep trying because you've already had this knowledge and it's going to be a waste if you don't actually cure mitral stenosis." So on the 7th person he did, and he was trying to do it with aortic stenosis, but he failed, and because of this, the person before, he kind of stopped, but he sort of got a little bit more encouraged because the lady that he operated on after she died, her friend delivered a note to Dr. Harkin in case that she died, and sort of a forgiveness from the grave. The note was saying, "Thank you for the chance of trying to cure me." And so this kind of pushed him a little bit more. Then later in the story, they sort of slide on to this other younger surgeon named Dr. Horace Smitty. And Dr. Horace Smitty, he also gained some success in mitral stenosis and also looked towards the aortic valve. And so he continued, and he tried to encourage Dr. Alfred Balak to attempt the surgery, and he would even give him a suitable patient. And the reason why he was so into aortic stenosis is because Horace himself had aortic stenosis, kind of a little twist how a cardiologist has a problem that he's also trying to solve. And he said if Blalock was to be successful, he would have himself be the patient for him. But sadly, as he put his finger through, it was sort of putting a finger through a bullet hole, and the heart literally exploded in front of his face. So, again, as Blalock did not already like Smitty's idea, he eventually totally forgot about it, and Smitty eventually died at age 34. So, currently, aortic valve stenosis and mitral insufficiency. Insufficiency is when it doesn't close all the way, so then there's some backflow of the blood, are a little bit more common in some adults, and they're the most common valve deformities in adults for the heart. And usually if you were to have aortic stenosis, you would have chest pain, heart failure, or you'd be fainting until you would die. And actually famous actors such as Arnold Schwarzenegger, who played as the Terminator, also had heart deficiencies such as aortic stenosis, and was publicly discussing the therapy for it. And this sort of leads me to I think we have passed 7 heart diseases so far covered in the book, and so I made this little chart because it was a little hard to show with my model. But if you were to look here, so the first one I did was VSD, ventricular septal defect. And so that's when there's a hole in the heart in between the 2 ventricles. This is a little bit more serious than atrial septic defect, which is a hole in between the 2 atriums, because this is where most of the blood goes to reoxygenate, and this is where a lot of the blood goes to the rest of the body. So mixing blood is not really it's not easy for the body to take in, because maybe deoxygenated blood goes back into the circulatory system, which is not good. And maybe reoxygenated blood gets reoxygenated over and over, which is a waste of time for the body. And again, arterial septal disease, kind of the same thing. Blood goes in the wrong place. So those are 2. The other 4 are mitral stenosis, which we did talk about, is when the mitral valve does not open up enough. Or mitral insufficiency is when the valve doesn't close and thus has some backflow. And then we have aortic stenosis, is when the valve is closed too much, not enough blood goes through. And aortic insufficiency is when the valve opens up a little bit. And then we have CAD, or coronary artery disease. So when, this one I actually have to show the model. It's when the coronary arteries are blocked up by so much plaque that, well, if blood doesn't come here, because the blood here actually helps the heart function. So if there's not enough blood here, the heart starts working slower, or it starts having to work harder because it's trying to pump its blood through, and sort of makes a cycle that constantly fatigues it even more and more. So this causes the patient to have shortness of breath. And I think that's about all of them. Yeah, that's all 7. There are leaky valves too that was talked in the beginning, but that still fits in mitral and aortic insufficiency. But yeah.
So what did you learn? The thing that was most interesting to you?
I think the most interesting was how Dr. Horrence Smitty also had aortic stenosis, and he was a cardiologist, so I thought that was kind of a good motivation. I mean, you don't have to have a heart defect to want to be a cardiologist, I think, but I don't know. I'm just so I think it was really interesting how he still tried to tackle cardiology even though he had this problem.
So all these things all these diseases that you show right now, are they all have a solution today, or you don't know yet?
I'm pretty sure they all have a solution. I know VSD and ASD, the septal defects, which are the holes in between the 2 chambers. I'm sure that those have solutions because I saw online they put like a little probe, and then they have like this little thing made of metal, sort of whenever enough air is applied through the tube that they stick in, it goes together, and so they put it in between. It's kind of like a little cap in between the hole. And mitral stenosis, well, I know the one right now that we're given, and I think atrial stenosis has a very similar solution. But yeah, I think most of them have a solution. I'm not sure about mitral and aortic insufficiency. I think that was given in the beginning of the book. But yeah, coronary artery disease also has a solution as well, but yeah.
So as of today, so you said you were very motivated by learning about the heart. So did any of this motivation, you're still interested, but is there any other reasoning you are behind this interest?
I mean, this is a book of the past. They're talking about past history of the heart. And so I kind of want to, take some time for myself and search up if the solutions are still the same, because if they're still the same, it's going to be maybe half a century old. So that's quite a while. So I don't know, maybe I'm going to think about it and maybe think a little bit through, is there a better way we can solve this? But yeah.
Okay. Thank you.
Thank you.